The video will begin with an introduction describing what patient safety is. The video will then discuss the importance of patient safety, followed by a list of statistics. Next, implementation of patient safety will be discussed, advancing patient safety in residency programs, and where patient safety occurs. The video will then talk about how patient safety is achieved and the approaches that need to be taken, such as root cause analysis, PDSA, and failure mode effects analysis. The video will then focus on the importance of patient safety in education and how this area needs great improvement. It will look at how current methods are ineffective and how new methods need to be considered. The video will then show two scenarios. One scenario showing how patient safety is ineffective through certain teaching methods. It will display that ineffective teaching methods puts the patient at risk. A second scenario will show how alternative teaching methods can greatly improve patient safety.
Quality of care is measured by various dimensions, one of them being patient safety. Patient safety is fundamental to all aspects of healthcare and is commonly the most important priority in all healthcare settings. Patient safety is defined as actions undertaken by individuals and organizations to protect healthcare recipients from being harmed by the effects of healthcare services. Due to the increasing number of medical services, complex procedures, medications, and patients, the potential of adverse effects regarding treatment has significantly increased. The following slide consists of statistics portraying the incidence of compromised patient safety during surgery in Canada and the United States. This bar graph depicts the rate of incorrect site surgery during craniotomy, lumbar discectomy, and cervical discectomy per 10,000 cases in Canada in 2003. This bar graph depicts the percentage of hospitals in Ontario in 2008 that implemented in-hospital infection prevention initiatives such as reuse of single-use medical devices permitted, reporting surgical infection rates after specific procedures, reporting on all surgical infection rates, surveillance method reporting daily, and lastly, fully implemented formal mechanism for auditing hand hygiene practices.
In order to improve patient safety skills, planning patient safety education, and aligning QI initiatives in an organization, it is important to take an interprofessional approach. In Canada, the Patient Safety Education Program allows for interprofessional teams to become certified as patient safety trainers over a 2-day educational event. This allows for train-the-training team model and ultimately a peer-to-peer education framework. The Canadian Patient Safety Institute program emphasizes case-based learning tools, moving beyond blame to systems thinking, applying human factors to the workplace, understanding teamwork, how to teach and implement patient safety, and evidence-based practice for improving safety. Advancing Safety for Patients in Residency Education, also known as ASPIRE, holds a dynamic event providing a national faculty development certificate program for physicians. This event focuses on teaching patient safety and quality improvement to medical educators who have expressed interest in patient safety. Participants of the program learn how to incorporate patient safety and quality improvement content. They also develop training that will allow them to take a leadership role in teaching patient safety and QI to fellow colleagues of their institution. Where does patient safety happen? Patient safety occurs where patients receive healthcare treatment. This includes operating in emergency rooms. In circumstances where patient safety occurs, there is patient-caregiver interaction. There must be a concern for the entire system as a whole. An understanding that there is potential for unpredictability that can impact patient safety is needed. An example of this would be 2 members of the surgical team having to leave the OR for an emergency, which could have an impact on patient safety. How is patient safety achieved? High reliability design allows for all components of healthcare delivery to be integrated into a reliable system, even under complex conditions. Components that would contribute to high reliability design are lean processes, Error traps, which is understanding that unpredictable situations can occur and error is highly likely in these situations. Responsiveness to protocol and necessary response required for the situation. Examples of this would be routine care situations managed with protocols that allow for little deviation, unique care situations allowing for significant deviation from the protocol, and immediate innovation required. Safety science knowledge methods allow for high reliability designs to exist. Examples of safety science knowledge are root cause analysis, which involves retrospective analysis of what went wrong to improve future care, plan, do, study, act, failure mode effects analysis, which allows for a proactive approach that tries to anticipate and prevent adverse safety events in the early development of a product, and multiple methods which are necessary to prevent design failure. Measurements remain an important development area for patient safety.
As it has been discussed, patient safety is a critical phase of quality improvement. There are many problems with patient safety, so plans need to be devised to address this area of concern. There have been numerous studies done demonstrating that current teaching methods to medical students isn't meeting the goals established by the World Health Organization. Both the World Health Organization and the American Association of Medical Colleges have identified that patient safety can be improved by integrating this component further into medical programs. When integrating these components, it is important to consider the learning preferences of the students. It is important to consider students' attitudes and their preferences because this helps determine how students will learn better and which methods of teaching will actually be effective.
This scenario displays students learning about patient safety through lecture. As we can see, they are uninterested and uninvolved.
The study identified that currently most students learn the majority about patient safety in their 3rd and 4th years and in postgraduate studies. However, they have reported that they would prefer to be taught about patient safety during clinical skills in their 1st and 2nd years of education. Additionally, 80% of students reported that they preferred and learned better when it was taught and integrated into clinical settings rather than pre-clinical lectures and online modules. Students rated that the least efficient and effective way they learned about patient safety was through independent studies of readings, learning through computer modules, and large group lectures. They rated their highest preference to learning through physician-guided quality improvement projects on a real panel of patients and real-life examples of quality improvement projects presented by physicians. It is clear that students prefer to learn through a hands-on approach versus lectures and independent studies. A study was conducted to determine what students preferred. To determine what they preferred, numerous questions were asked, such as how students would prefer to learn about patient safety, how much they were currently learning, and the importance of learning about patient safety, to name a few. The majority of students rated learning through real-life examples of patient safety and quality improvement as the most beneficial and helpful. One quote was provided from the study that really captures how the students feel. This quote was, "Any situation that causes us to act, rather than simply read from papers or listen to lectures, is going to be helpful." They said, "I learn by doing."
A surgeon starts to close a patient's surgical incision at the completion of an operation for extensive bowel repair, not knowing that a surgical sponge has been left inside the patient. Let's take a look.
Is it a crime that I like to focus when I am in the workplace? If so, my apologies. I focus. I focus like a laser beam. That's why I don't make mistakes. That's why my patient survives surgery. I am not sloppy or careless
We're missing a sponge.
or inconsistent like many of my colleagues are. Like, frankly, most of my students are. While you and Chatty Cathy over there were discussing the magic of your lunch, I was focused enough for the both of us.
Dr. Robert,
What?
we're missing a sponge.
Well, count again.
We did 3 times. We've looked everywhere except
Except where?
Inside the patient.
36, 37, 38, 39. No, the sponges is all here.
Keep looking.
Dr. Robert, we have to close. She's been under way too long.
You have your boards coming up. Is this what you want on your record? Don't just stand there, check under the liver again.
It is under the liver.
I thought I taught you the simple and reliable rules Like when you find a problem, you first look and check again. You double check, you triple check. In this case, the student was taught about patient safety through lectures and modules and was not taught through a clinical setting with hands-on experience. This led to patient safety being compromised as she didn't know how to react appropriately to the situation in a quick manner. As seen in the video, the patient died.
The scrub nurse does a sponge count and discovers one is missing. The surgeon locates the sponge inside the abdomen and removes it before closing the incision.
36, 37, 38, 39. Dr. Robert, we have 40 surgical sponges, right?
Correct. Why do you ask?
Because we only have 39 here.
Okay, Dr. Brown, before closing this patient's incision, we must locate the last sponge.
Dr. Robert, where should I look?
Check under the lever.
I got it!
Good job, Dr. Brown. Nurse, can you count the sponges again?
All 40 sponges are accounted for, Dr. Robert.
Perfect. Now, Dr. Brown, come and take a close look while I close up the patient. In this case, the student was taught about patient safety through a clinical setting. As we can see, there is much more learning taking place as well as effective communication between the student and the doctor. This type of learning style shows to be much more effective regarding patient safety as a patient didn't die in this scenario. It is clear that different teaching methods have different results on patient safety. Patient safety is a fundamental aspect of healthcare. It is important to ensure that patients are not harmed by healthcare services. As shown by statistics and supporting information, patients are dying from medical procedures and are experiencing other harmful effects. There are many approaches implemented to address patient safety, however, there has been a lack of focus on the teaching methods. When focusing on teaching methods, it is clear that this area needs to be improved, and it is clear that students are in favor of a new curriculum. It is essential that medical schools begin to integrate patient safety into clinical experiences rather than keeping them separate and taught in a standard lecture format. This emphasizes the importance of patient safety to one's future career in the healthcare field.